Does Suboxone interact with antibiotics?
Suboxone does interact with antibiotics. So two things can happen when you do take an antibiotic with Suboxone. It can, number one, decrease the actual effects of Suboxone, and we'll talk about what happens after that. Or it's going to increase the effects of Suboxone. So with antibiotics, when you do take them, they change the way that your stomach releases enzymes to break down other chemicals, food, drink, medications even. Erythromycin, ciprofloxacin, and these are some of our most common antibiotics that we use for infections, ranging from bladder infections and UTIs to pneumonia and bronchitis. So we know that Suboxone attaches to the opiate receptor. Well, if you're not getting as much medication absorbed into the body because your antibiotic is decreasing the amount of medication available, sometimes you can go into symptoms of very minor withdrawal. That can look like a little bit of anxiety. You might just feel off for that day, but unsure why. So that could be something that's coming from your antibiotic dosage. So if the medication or Suboxone goes up in the body and there's too much available, while this is rare, a lot of times you can have lethargy or just feeling too sleepy throughout the day. Some people will get headaches from this. So it's one of those things you really want to pay attention to when you're taking antibiotics and Suboxone. One of the best things to do is always touch base with your provider, and actually maybe even have both providers touch base with each other. Your Suboxone provider can give guidance on their expertise, and then whoever prescribed the antibiotic can do the same. We want to make sure that you know how to take the medication appropriately so you don't get any of the effects that we talked about. What I would suggest, and if you look at research, keeping your Suboxone dose away from your antibiotic dose is the best. So what does that look like? If you take your Suboxone at 8 a.m. in the morning, but you're also supposed to take your antibiotic at 8 a.m. in the morning, what we can say is pull your Suboxone dose maybe to 7 and then take your antibiotic dose at 10 a.m. Having 2 to 3 hours away from each other can help support the medication not interfering or interacting with each other, but it is always best for you to reach out to your provider so you can have an actual plan of action if, say, for instance, you do start to feel a little bit ill after taking the antibiotic.
In addition to antibiotics, there are other common medications that have the same effect that may increase or decrease the Suboxone levels in your system. So
Agreed.
again, as Micah said, discuss this with your provider. There's some other antidepressants. There are some antifungals. These are pretty common medications that can affect it. Shouldn't be too dangerous, but safest thing to do is having a conversation with your providers about potential medication interactions.